Hello, everybody. This is Betsy Wurzel, your host of Chatting with Betsy on Passionate World Talk Radio, where we educate, enlighten, and entertain. The views of the guests may not represent those of the host or the station. Folks, you're going to want to listen to this podcast. Yes, I do get excited with every guest that I have coming on because I get excited about what I do. And this book that my guest wrote is just phenomenal. I can relate to it. I worked in the medical field. I love Dr. Mark Vonnegut's honesty. And when he's writing about the healthcare system and the stories of his children, he's the pediatrician. And I want to tell you the name of the book is The Heart of Caregiving, A Life in Pediatrics by Dr. Mark Vonnegut, who is a graduate of Harvard Medical School. And I just want to thank you, Dr. Mark Vonnegut, for coming on and writing this book that I think everybody should read. So thank you for writing this book.
Well, thank you for having me.
You're welcome. Can I call you Dr. Mark?
Yeah, that's what I'm mostly known as.
Oh, okay. Last name, I just don't want to mispronounce your last name, but Dr. Mark, I have to thank you really from the bottom of my heart for writing this book. I really enjoyed reading this book, and I just know that you are a man of compassion for reading this book. I'd like to know what inspired you to write your book, The Heart of Caregiving.
Well, I absolutely, I've had a very wonderful career taking care of kids, and I think the next generation of patients and doctors is going to have a much harder time getting compassionate care, getting enough time to explain their concerns to doctors, and I think the whole thing is becoming much more of an assembly line. And as somebody who has really loved practicing medicine, that's very hard for me to accept, and writing the book felt like a good thing to do.
Yes, I agree with you 1,000, not 100%, 1,000%, and beyond, because I have seen it myself as a patient, as a caregiver. I feel that there's going to be a shortage of doctors because doctors are leaving, they're retiring, they're at that age, and nurses, they're retiring. I feel sorry, actually, Dr. Mark, for people going into the medical field and being doctors because of bureaucratic red tape, because they can't practice medicine like they want to because they are ruled by the insurance. It's the insurance the insurance companies that have really messed up medical care, health care, as far as I'm concerned.
It's like, well, people who go into medicine do not do it for money, and if they were doing it for money, they're probably not smart enough to do the job. And but what the question that these people have is, when do we get to serve patients? When do we get to help patients? And if you're in a situation where you have to see 6 patients an hour and you have to spend 2 hours clicking on worthless computers, then people get, and I think that's what burnout is about. I don't think it's hard work. Doctors and nurses have always worked hard, and that's what they went to school for. And at the end of their education, they find they're not able to do what they want to do. They're not able to use their creativity and intelligence to take care of patients.
Absolutely right. My husband's hospice doctor, and this is 2 years ago, told me he has 15 minutes a patient.
Mm-hmm.
And
Mm-hmm.
for those who are 65 and older, he has to discuss end-of-life planning. And I said, well, I think it should be
Mm-hmm.
discussed long before the age of 65. And he said, along with everything else they have to discuss. And it is hard for doctors to, I think, they want to listen, but they don't have the time. They run with the computer. Some doctors I go to have their computer, and I feel like they're looking at the computer, writing their notes instead of looking at me, or when my husband was alive, looking at him. And this is where where I saw the difference. And I've had doctors. Go ahead.
It didn't used to be that way. When I got out of medical school, I would say that 90% of our time and effort was spent responding to the concerns of patients. And that was true of hospitals too. And I think that number is now down around 50%. I think the average doctor visit is 10 minutes. The average patient gets interrupted 10 seconds into their story, and they're told, well, you realize I don't have enough time, and 40% of that 10 minutes is spent with the doctor not looking at the patient or listening to the patient. They are looking at a computer and clicking in data that they're told they won't be paid unless they do all the right clicks.
Yes, this is very true. Absolutely very true.
You're absolutely not going to get a good diagnosis. You're not going to have, a relationship with the patient, and that's not just, rainbows and unicorns. It's coming up with a diagnosis that works, and we have wonderful things we can do in medicine, but we're not doing because we're not making, trusting relationships with patients.
Yes, I agree. And I know doctors spend a lot of time with the insurance companies trying to get medications approved, trying to get procedures approved. I know with medications, it's a lot of paperwork that the doctor now has to do that they didn't have to do 40 years ago. And you discuss that in your book, how much, the practice of medicine has changed.
And, it's very true. And the prior authorizations and all that, the thing that is infuriating is you have these wonderfully trained people, and they and their patients work very, very hard and come up with a plan and a medication, and then they are second-guessed and often not able to come up with that plan. What is the chance that somebody who has not had any medical training can improve care by second-guessing an experienced physician and a patient who needs help? The chances of them improving that care is zero. And I wrote in the book that I have patients where I literally have to write a letter to the insurers that a cripple, a child who needs a wheelchair still needs a wheelchair. That is ridiculous. And I wrote one letter. I had to write it every year that says Maggie Kerr still has no left leg. Now, this isn't. It sounds silly, but it's more than silly because it's the insurer increasing overhead and telling the doctors and the patients who's in charge. And it's not the patient and the way it used to be, and it's not the doctor serving the patient the way it used to be. It's the insurer, making sure that they're in charge.
Yes, very much so. When my husband went up to the hospice unit, the doctor said that they have to follow protocol per Medicare, or they will not be reimbursed. And he even told me, he said, even if they follow protocol, Medicare still may not pay them. So, you know, they find a little glitch or something that they might not have followed. I mean, it's just very alarming. I have to ask you this, Dr. Mark, since you are a experienced pediatrician. I would like for you to tell us, what should parents or guardians look for in picking out a pediatrician? What are some qualities?
It's very hard. You want to look for somebody who is compassionate, who you feel is listening to you, and it's mostly about listening. And it's mostly about somebody who's looking you in the eye, and you can tell, is looking to make a healing relationship, which is a complicated thing. And sometimes it requires a doctor to sort of share their frustration. And I have people who don't want their immunizations, and I think at least half of that is because people don't trust us anymore because we're not working for them. And I say, yes, they are liars, brigands, and thieves, but you're still better off having your child immunized. But so I think patients should know, and I think doctors should do more expressing of their frustration so that we can reestablish sort of the natural alliance of patients and doctors and nurses, because nurses and doctors are trained to be advocates for the patients, and they're not being allowed to do their job.
Yes, I also encourage people to be their own advocates and questioning their doctor, and if they have a different opinion or they don't have peace about what the doctor is telling them, then to go for a second opinion. But I love that you said to listen to the patient, because that is so important. And I hear this a lot, that, oh, my doctor doesn't listen to me. My whoever, nurse practitioner doesn't listen to me. How do we get a doctor to listen to us?
It's hard, and I do think there has to be an alliance. And I think the most effective voice in this conversation has been nurses who have fought hard to take care of patients, take care of 4 patients a shift rather than 6. And this is clearly not about money. It's about the quality of care. And insurers, say that they care about the quality of care, but the quality of care in most hospitalizations is, do you have access to a nurse? And so I think there should be alliances around issues like that, and nurses used to be in charge of staffing levels, and they should be, we should also be doing things like saying, co-payments do not help patients. We all took a vow to do no harm, and I do think doctors have, out of fear or whatever, they have complied too much with the demands of insurers, and not as much with they don't think they have a choice. And to a certain extent, with their incredible levels of student debt and things like that, individual doctors don't have much of a say. And I do think the natural alliance between patients and nurses and doctors should be standing up for the quality of care. And that's hard to do, but I think that's what has to be done.
Yes. I mean, as a person, I'm 64 years old. I have worked in the medical field, and I definitely have seen a difference with nurses. I worked in a hospital many years ago, and it's always been a staffing problem, always. I had worked night shift. I had 12 to 18 patients. 12 to 18 patients. How could I give quality care? I couldn't. It was very frustrating.
And it used to be different. It used to be in emergency rooms, doctors would say, I need a nurse here. And it was up to the administration and usually the head nurse to get support where it was needed. We ran an emergency room without a pediatric nurse. We complained, and we got a pediatric nurse. But now is the hospital says, we can't afford this. And if the richest country in the world spending twice as much on medical care as anyone else, if we can't afford to do a basic quality of care measure like adequate nursing, that's insane.
Yes. It's always been short-staffed as long as I can remember when I was a candy striper, and I'm going back into the early 70s here. I actually saw a nurse cry. I'll never forget it. She worked 3 to 11. It was one RN and an aide to probably over 30 patients. And she sat there and she cried. I understood. It's just dangerous. Go ahead.
And in that absolutely same thing, doctors are trying to do a good job, but they don't have the resources, they don't have the time to give to patients. And I think I said at some point that the best way to provide good care to the patient is to be looking them in the eye and shutting up. I mean, I think that if there was an ICD-9 code or whatever for keeping your mouth shut and listening to patients, we'd get better diagnosis and we have better outcomes. One thing I don't think people realize is that bad medical care or second-rate medical care affects everybody. It's all about public health. We are our brother's keeper, and if we're not, we're going to get sick, whether it's COVID-19 or obesity or diabetes. We all benefit from the rest of us all getting good medical care.
Absolutely. I have to tell you this story. My son, I knew when he was 6 months old that something wasn't right by looking at his eyes. It looked like he was in another world. And I complained when Josh was a year old. He was in a jamboree that he wasn't doing things like the other children. I know everyone, develops differently, but it was a significant notice. And the pediatrician told me I was an overprotective mother. And, of course, it was my fault. Anyway, I changed doctors, and my son did actually had, he still has it, cognitive disability. So do you recommend to parents or guardians to go with your gut instinct about your child? If you feel that there's something, right?
Absolutely. And and sometimes the parents are wrong, but that's the doctor's job too. But not just to say you have autism or you have intellectual disability, is to help the patient deal with that. Or sometimes to say your baby's fine, but you're depressed, and to get the parents help that way. But to be in a situation where you just want to say this is an ear infection and have that to be the end of the visit, or your child doesn't have autism, whether you're right or wrong, there has to be a more two-sided conversation. And as I say, where the doctor actually is quiet and listens to what the parent has to say. I would say parents are right more often than doctors.
Now, that's interesting. I tell people, go with your gut instinct. and to go for a second opinion. Don't be afraid. I think, in my opinion, Dr. Mark, any good physician would not mind if their patient went for another opinion.
Right. And I think part of being a good doctor is accepting the fact that you're going to be wrong sometimes and having that be okay. I tell stories in the book where I was wrong, and I was with the same patient. I was wrong more than once. But what a parent appreciates is that a doctor who will stick with the patient and the parents no matter what. And that's what parents appreciate. You can be a whiz of a diagnostician, but if you don't know how to talk to people, it doesn't do you any good. I think accurate diagnosis is important, but sticking with parents and children, regardless of what the problem is a more important thing to do, because eventually you'll get it right.
Yes, and I think people just appreciate honesty. Like I have respect for a doctor who'll say, you know what, I really don't know or not sure, go for another opinion. I appreciate that. I respect that immensely. I have to ask you, Dr. Mark, you went to medical school later than most people. Did you find that to be an advantage or disadvantage or both?
Both. I really found it was an advantage to have some real life experience and to have a sense of what I thought was important. And if you try to memorize and learn everything they say to you in medical school, you won't. You don't have time to breathe. And I was also one of the only people who had children in medical school, and that kept a good sense of proportion. But if you are a medical student who thinks that everything you're taught is important, I think that's a huge disadvantage. And I kind of like being 28. The funny thing is, I now consider 20. That I at the time thought 28 was old.
Just a spit in the eye, right? Now, when you look back, 28. And how do you? What kind of advice? Let me ask you this: would you give people going into medicine now, as far as being a doctor, of how to survive medical school?
I would have them ally themselves with nurses and patients and ally themselves with the idea that student debt impairs good care. And I would be mad, and I would be mad, in trying to get my patients to have good care. And I think that's what burnout is about, is you want to help people and you can't. It's almost like you're been given, an immoral order in a war situation because you're not allowed to do what you know you should be doing.
Yes, that's
so
true.
I think you should get mad. And as I say, the most effective voice for change at this point is the nurses. I would back the nurses up, and I would be honest with my patients when I wasn't able to do what I thought I should do, and I'd tell them why. And so I think eventually we'll get to the point where we'll say, in order to do no harm and to make good diagnoses and to help the public health, we can't do the things we're told we're supposed to do, and insurers do control, who gets paid and who gets paid what. We need primary care physicians, and at this point, we're getting more specialists because specialists are paid about twice as much as primary care doctors, and you come out of medical school and training with $250,000 to $500,000 of debt.
Yes, and I know it's changed. My primary doctor, her son just graduated the medical school, and I said, "Are you going to start your own practice?" And he said to me, "Oh, it's not like, how it used to be years ago. You can't just hang out your little shingle and start a practice. You have to go into a medical healthcare system or a group of doctors. No more lone doctors really by themselves. That's very rare to see right now, I think. It's just the one doctor by themselves."
And we have lost a great deal in the last 40 years. We've lost 40% of our hospitals. A huge amounts of rural America has no community hospitals. We've lost like 80% of our independent community physicians. And these people they were good doctors. They knew how to make good diagnosis and get patients good care, whether it was a hospital or a specialist. That job was done very effectively. I think now the corporate medical people would like to say, "Oh, that was all, horse and buggy days. You can't do it. You're getting better care now." That's not true. You got safer, better coordinated, and you got better care 40 years ago than you got now.
Yes, I definitely agree with that. Because if you had a problem, you felt comfortable calling up the doctor, and the doctor would get back to you. And now the doctor doesn't have time to get back to you. Maybe the nurse practitioner will get back to you, or the physician's assistant, and they may not have seen you, and they may not be familiar with you. And it does, make a difference. I'm curious as to why you chose pediatrics.
Because I loved it. It was really, I thought I would be a family doctor, and then I knew that the part of families I liked were the children. And I was more comfortable around other pediatricians than I was any other kind of doctors. So it was just a natural flow for me. But at that point, I didn't have to consider debt or any problems like that. Most of the world thinks that a well-trained doctor is an asset to their community. Many places in the world, the student debt a doctor comes away with is zero.
That's interesting. I enjoyed the stories in your book, and I want to know, what's your favorite story that you wrote about?
The favorite one is the shortest one, where I asked a child that told him he had to pee in a cup, and he asked me what was wrong with my bathroom. or the boy who threw up every time his mother fed him eggplant. I mean, it's just, you come to work not knowing what's going to happen, and usually there is, there's useful, important work to do, and sometimes, kids will really, really surprise you, and a lot of times it's sort of outside the box to, I talked about several times I've treated depression and anxiety by having a family get a puppy. That's not in any textbook.
That's right. That's right. I'm glad you brought that up, Dr. Mark, because I wanted to ask you, as a pediatrician, have you seen the difference in children and adolescents now with more stress, more anxiety issues, more mental health issues than previously.
Absolutely. When I became a pediatrician, I expected to be dealing with ear infections and pneumonia and making relationships with patients along the way. But I never thought that I would be seeing and prescribing psychiatric medications for anxiety and depression and ADHD. I thought that was all, and it was initially, that was the work of psychiatrists, but there are so few psychiatrists available now that it's really fallen to primary care doctors to become the diagnostician and the treater. So I've had to take courses to learn how to use medications I never thought I was going to be able to use. Not that I never thought I would be called upon to prescribe ADHD meds and anti-anxiety meds. I thought it was going to be mostly antibiotics.
Why do you, in your opinion, do you feel there's an increase in anxiety and depression with children other than the pandemic? I know the pandemic caused a lot of that, but besides the pandemic.
It was happening before the pandemic. I think there are several things. I think it's much harder and there's much more pressure on kids to perform in terms of academics, in terms of athletics. You see, 14 and 15-year-old kids, committing to colleges to play, hockey or football. And I think that puts so much pressure on. They're not allowed to be children. They become professional athletes. They have to, it's just the pressure on children is enormous. The other thing is a huge problem is social media, where we will have children going to sleep with a cell phone by their on the same pillow, and finding out who likes who and being woken up in the middle of the night. And a lot of the stuff on the internet is threatening and mean, and we didn't used to have to live with that.
Yes, that's true. And the bullying, I mean, back in my day, you were bullied to your face. You didn't have to worry about all over social media. And I'm so glad you brought that up, Dr. Mark, because I am a huge mental health advocate for children, for anyone, but for parents to realize when their child does have a problem and to seek help and counseling.
Yes.
And not to just think, oh, it's a phase, they'll grow out of it. When a child comes to a parent and says, I need help, please take them seriously and go for a counseling. There's a lot out there now.
And the problem is, I think a lot of parents know that, but I think the help is not there. There are no, mental health beds available to children that used to be there. There are no the wait to see a psychiatrist is 6 to 9 months. And one time in frustration, I said to the receptionist or whatever, I said, my patient doesn't want to kill themselves in 6 to 8 months. The problem is my patient wants to kill themselves now. So I think the lack of research, I think parents are smarter, again, than doctors most of the time about the needs of their children, and the help that they need is quite simply not available to them. They can call whatever, and as I say, to see a psychiatrist in Boston would, how many, I can't even keep track of how many hospitals we have, but it's 6 to 9 months to see a psychiatrist, which is why I end up, and other pediatricians end up having to be the ones who are prescribing these medications.
Wow. Yes, there is a a wait. I have heard that. I live in New Jersey, and in New Jersey, there's I just interviewed someone a couple of months ago. They have counseling for children. We in this state happen to have a lot, but there very well could be a waiting list, especially for in-resident places. There are to see a psychiatrist. There are, and then again, with mental health, as with anything else, and I know from my own insurance, who can afford a $60 to $90 copay a week?
Right. And if doctors were, if psychiatrists were able to do things at their own pace and see patients, without all the insurance mandates, there would not be so much of a wait, because you would have physicians responding to the needs of their patients, and also you would have a situation where psychiatrists were better paid, so that would be a reasonable choice coming out of medical school. So there are a lot of pressures on the mental health system that leave patients' concerns and parents' concerns unmet. Yes, I agree. Dr. Mark Vonnegut, I could talk to you for hours on end about the medical healthcare system. I'd like you to tell the audience, what would you like them to get from the book, to take away from your book? I mean, I know there's a lot, but because your book is phenomenal. I have a sense of optimism, and I think optimism leads to action, and I think we can get to a place where we take much better care of patients. And I think patients have a role in that, nurses have a role in that, doctors have a role in that. We should not be satisfied with the care we're getting now, because from most people's point of view, the care we're getting now is not good care. It's ridiculously expensive, and we have to take control again of who's in charge. It used to be that patients and nurses and doctors were in charge, and the role of insurance was to pay the bills. Yes, and that has, as you know, has changed. I mean, your overhead is more. You have to hire different people to, take care of the insurances. So, you don't have to be on the phone. I'm sure sometimes they do need to speak to you. And it's just, I'm sure, a lot of, pressure, because you want the best care for your patients. And I'm sure as a physician it probably bothers you, because you can't give it to them because of these regulations and rules from the insurance companies. And here's another thing. Excuse me. Go ahead. Another thing I think patients and parents can come away from in terms of the optimism is we should be holding insurers to the same standards when we don't approve a medication unless we're sure it's safe and it doesn't harm patients. We should be looking at copays and deductibles and all these things. They should not be part of medical care unless they're proven to help patients. And we certainly have plenty of evidence right now that most of the things that insurers do to make insurance more profitable are actually hurtful to patients. They take away money, they take away time, and they sort of disrespect patients and parents. Yes, and yes, go ahead. If we got together and we said, we are not going to do things that harm patients, and patients aren't going to accept care that hurts them, like an 8-hour wait in an emergency room, that's not acceptable. And if we had that attitude rather than, yes, Mr. Insurance Man or yes, Mr. Pharmaceutical Man, we'll pay you $1,000 a pill, until we get rid of that attitude that we should be complying with them rather than meeting our needs. But I do have a sense of optimism that that's going to happen.
Well, I sure hope that the tide changes. I know that some insurance companies even disrespect doctors by not calling them a doctor. My cardiologist told me that he talked to a insurance company, and the person referred to him as a healthcare provider. And he said, if you don't call me a doctor, which is my title, then this conversation is over. I am a doctor, not a healthcare provider.
And patients are not called patients anymore. Patients are covered lives. So so the provider is taking care of the covered life, and and so they have changed the names of things, and it is about power.
Yes, and it seems like the doctors and nurses are losing their power because of the way the industry is. And I love how you keep saying in your book, listen to the patient. Doctors sometimes need to shut up, knowing that the exam is over. Listen to the patient. Give patient care back to the doctors and the nurses. I love that. I absolutely love your book. I really do.
Thanks.
And I just want to tell the audience, I worked as a nurse, and what is in this book is 100% truth. I can testify to that. It is true. Doctors and nurses suffer burnout exactly for what you said, Dr. Mark, because you want to give the best care, and you can't when you have 12 to 18 patients. I'm talking as a nurse, or if you're a doctor and say you have to see, 50 patients within 3 hours. I mean, how can you give the care? And I do hope it improves.
Right. It has
I really do.
And it has to improve, and I think it will, because what's going on is intolerable, and eventually all of us need medical care, and it would be nice to have it accessible and affordable when we need it.
Yes, and I have to say I like the story where it was a friend of yours went to urgent care for a problem they were having with their foot, and how they had infection, they had a whole bunch of complications from it. You should have heard me yelling in New Jersey. I was reading your book, and I'm like, yes, Dr. Mark. Just so from the heart, your book. It is, and I love the name of it, The Heart of Caring, and I like your book cover. The cover of the book, it has a heart with the monitor lines, because you have a wonderful heart, Dr. Mark, and it shows through your book. And I could just I just feel it. I feel your energy. And again, I thank you for your service to others and helping people, helping your patients. Thank you so much. Thank you for becoming a doctor, and really thank you for writing this book. Folks, the name of the book is The Heart of Caregiving, A Life in Pediatrics, by Dr. Mark Vonnegut. I'm going to spell the name for you, Vonnegut, available on Amazon.com, and check your local bookstore. If they don't have it, please tell them to order it. And I want to thank you, Dr. Mark Vonnegut, for coming on my show, Chatting with Betsy. You are a wonderful, compassionate person, and I could talk to you for hours. So I want to thank you so much for coming on my show.
Thank you so much. And I think,
you're welcome.
All I'm doing is what my teachers trained me to do, and I think we have a wonderful profession that has learned how to care for people, and we're not being allowed to do it.
That's true. That is very true. I run a group for caregivers, and I hear all the time, my doctor's busy, my nurse is busy. They're not listening. And I say,
Right.
you know, and I'm sure you'll agree with me, Dr. Mark, it's important to prepare for a doctor's visit. Have your notes ready. Have your questions ready. Be prepared.
Yep. and the doctor should go into a room saying, how may I be of service, and mean it.
Yes. Yes. Oh, I just love talking to you, Dr. Mark Vonnegut. And you're still practicing. How long do you think you'll practice for?
Somebody asked me today, I said, don't worry about it. I'll be here till I'm 100.
Well, you know what? That's good. We need people like you to keep practicing until you're 100. So why retire if you don't have to? That's great. Well, thank you again, Dr. Mark Vonnegut. I appreciate you coming on and writing your book. Folks, thank you for listening. Please share this podcast to help other people. This is what this podcast is for. It's for helping other people. And if you missed any of this podcast, you can catch it again wherever you hear your favorite podcast. It is free to subscribe to Chatting with Betsy on Spotify, Spreaker, Amazon.com, and many other platforms. I want to thank Jeannie White for writing the blog, producing the show. Please read the blog. It will have information about Dr. Mark Vonnegut. And thank you to Lynn Caldwell, who's CEO at Passionate World Talk Radio, who makes this all happen. And I want to give a shout-out. Thank you to Lisa Warren, president of Lisa Warren PR, for arranging this interview. And thank you again, Dr. Mark Vonnegut, for coming on. Folks, you know what? We need to be our own advocates. We need to speak up. And I want to just give out this suggestion. When you go to a doctor, have your questions ready because they don't have the time. Be prepared for your visit. Know what you want to ask. And make sure you as the patient or the advocate listen carefully to what is being said. And that's what I have to say today, folks. This is Betsy Wurzel, your host of Chatting with Betsy at Passionate World Talk Radio. Thank you again for listening. And if you haven't already subscribed to Chatting with Betsy, it's free. Please do so. In a world where you could be anything, folks, please be kind. Be blessed and take care. Bye-bye now.